Two leading health insurance companies, one crucial comparison. Which one truly takes care of you? On one side, Aetna, a name with a long history and nationwide presence. On the other, Clover Health, the bold challenger with innovative tech-driven plans. Let's skip the marketing talk and focus on what actually matters for your health. We're breaking it down by category, points awarded, so you'll see a clear winner in the end. And trust me, the final result may surprise you. Here's the game plan. We're going to compare these two across a bunch of key things: cost and value, provider network, tech and digital care, Medicare focus, geographic reach, and of course, customer experience. I'll walk you through every category so you can really see what matters most for you. Let's kick it off with cost and value. So Aetna Classic, you get wide plan availability, which is great, but if we're being real, their costs can creep up if you don't qualify for subsidies. It's kinda what you'd expect from a bigger insurer. Now moving on to Clover Health. Here, where things get interesting. Clover actually offers some of the lowest premiums out there, and their out-of-pocket maximums are surprisingly competitive. The catch, their plans aren't everywhere, but for bang for your buck, Clover really wins this round. Next up, provider network. Okay, with Aetna you're getting that massive national network. Seriously, finding a doctor is like one less thing to stress about. Tons of hospitals, tons of choices, though heads up, their provider info databases sometimes, can be a little, let's call it, out of date. But yeah, options galore. Now, Clover Health, they're working on expanding partnerships, especially in places like New Jersey or Texas, but honestly, the network's way smaller and super regional. So if you love choices, Aetna's totally got this category locked down. Alright, tech and digital care, this is where things really split. Aetna's no slouch, they've got a solid online portal, telehealth on every plan, all the basics. Useful but nothing too wild, but check this out. Clover Health has this AI-powered Clover assistant that helps doctors give really personalized care, and they're all about using data to get ahead of health issues. Now, some older folks do say the tech takes some getting used to, but honestly, if you want something kind of next-gen, Clover takes the win here. Oh, and here's something cool you probably didn't know. Clover Health was actually first in the US to roll out AI assistant tech for Medicare doctors. Wild, right? That's some Jetsons stuff happening in healthcare. Now let's geek out over Medicare focus. Aetna for sure has a big lineup: Medicare Advantage, SNPs, supplement plans, you name it. They do it all, but the thing is, they feel a bit more one-size-fits-all than super tailored. Clover Health, on the other hand, is entirely about Medicare Advantage. That's literally their whole thing: customized care for seniors. If you want a company that lives and breathes Medicare, Clover's your ticket. Let's talk reach, geographic reach, that is. This one's pretty straightforward. Aetna's available in all 50 states. You could honestly throw a dart at a US map and you'd probably land on an Aetna plan area. Local details differ, but still, you're covered. Clover, though, they've got some legit options in certain places like New Jersey or Texas, but if you're not in those key regions, well, you're kind of out of luck. So the clear winner for coverage everywhere is definitely Aetna. Last up, customer experience. So Aetna's been around forever. Solid resources, lots of experience, pretty typical of a big company. Feedback shows that most folks are satisfied but like not blown away. Now, Clover Health puts a lot of energy into personalized service, especially where they have a presence, and you'll actually hear about these super engaged care teams. But yeah, there are some mixed reviews, especially about glitches and service hiccups. Honestly, this one's pretty much a tie, nobody's perfect here. Just take a look at the radar chart lined up here. You can see exactly which categories each company just nails or, kinda doesn't. It's almost like seeing their personalities drawn out side by side. So here, where I net out. If you want stability, broad access, and you live anywhere in the country, Aetna's gonna feel pretty safe and reliable. But if budget rules, you love the idea of innovative care, and you're in one of their active states, Clover Health honestly brings some fresh thinking to Medicare. You just have to make sure their plans are available where you live. Was this insurance face-off handy? Let me know if you want more head-to-head breakdowns like this. And hey, hit follow so you never miss out on tips for picking your next health plan.